after that. It's a very hard act to follow. But I am going to invite all the speakers, including Catherine, to come down to the large desk here and participate in a panel discussion, which we have about a half an hour, and we can take any questions. I think we have a roving mic somewhere around, somebody who can take the microphone around. So if you have a question, please just raise your hand. Maybe we could have the lights up. Maybe that's all the light we can get here. I'm not sure. Any more lights? The lights are maxed. Okay, we can't. Okay, any questions? Yes, right here in the center. You want to stand up so everybody can hear and use the microphone that's being brought around?
Sure. Hi, thank you. My name is Nicole Herons. I am a holistic nutritionist. So my question revolves around, are there studies being done on the people who are carriers of one of the mutated genes who are not getting cancer? So what are the similarities between these people who's allowing them to survive without contracting cancer?
No, it's a good question. I don't know if we have an answer for it, but I'm going to try Rob.
So to the best of my knowledge, there are interventional trials that go on, like aspirin and they say starch, the equivalent of high fiber. So that type of interventional trial. So there's now a CAP3 trial looking at doses of aspirin in terms of Lynch syndrome as a follow-up. But in terms of environmental or lifestyle issues, to the best of my knowledge, there are not. So there are prevention things, looking at populations, so surveillance, and interventions in terms of aspirin specifically, but other things have been of interest, but not specific environmental things. But I mean, I would, in a non-pure scientific way, mirror what Ms. Cosgrove said, and certainly I'm sure what you stand for, which is that motherhood is motherhood, so we should all be living well, and certainly these are important things in terms of everybody's well-being.
I just wanted to add one thing to that. There is a great studies with regards to gynecologic cancer, but one of the phenomena in endometrial cancer in general is that it is a cancer in the general population of obesity, and so it is a rising cancer compared to lung cancer, which we've at least leveled off, and some cancers have decreased. So the question is there a synergistic effect with those who are obese and have genetic mutation, or overweight, or have diabetes, which are associated with endometrial cancer in the general population? And I don't think we know that. We do. I think it's something to be. It is something modifiable for sure, and something that people can have under control to try to decrease their weight and in a healthy way, minimize diabetes, which are all associated with endometrial cancer.
I don't think we've given you a very direct answer, but I don't think there is one, really. I think that turning it back towards you, maybe somebody like you or one of your colleagues is interested in this, could partner with us and do something in this area, because the whole, the whole area that you're talking about is not well evidenced, and there's not a lot of data from the people that are actually doing it, which I think is not the right way to proceed. Next. Yes, way back in the corner.
My name is Sasha, and I'm a patient of Dr. Robert Grant, who knows me very well this way. I have one question related to the actual research, because I understand that Lynch syndrome related to the gene which is faulty, which carries fault information. So the question is there any research done that maybe could extrapolate that could affect the actual gene trying to correct?
Well, other than to say the body is trying to correct it all the time, I'll turn to Rob again.
So the whole area, first of all, I think it's very important to understand, I'll give 3 seconds of genetics 101. So everybody with Lynch syndrome carries one bad copy of a mismatch repair gene in every single cell of their body. Cancer arises, we believe, because the second copy in that particular cell, in that particular tissue, also ends up having a problem so that neither copy of the gene works. But so really most of the research has been in terms of reducing the risk of cancer, detecting things early. What you're talking about is gene therapy, and gene therapy is not being currently pursued in Lynch syndrome, and in fact it's an extremely rare thing in genetic disorders as a whole, and that's because there are very, very, very major medical hurdles to overcome to do that. It is being pursued, though, specifically in therapy. So if we're trying to develop smarter drugs that specifically act on cells that have problems and Lynch syndrome is is certainly an example of that, where it exploits the fact that the cancer cell is different than a normal cell because it has 2 bad copies of that. So not so much in preventing disease or changing our genetic makeup, but in terms of dealing better with treatments, there's a whole body of research going on in that direction.
Do you have someone over here? Let me just ask a question just before we go on. Sarah. And Sarah, you're dealing with, let's say, a 25-year-old woman, and that woman has a big tumor in her ovaries. There's no family history. What do you tell the pathologist, and how do you recognize? What do you do so the people will understand how we get to the fact that we have identified a mutation?
The process after surgery
Yes.
to identify. So,
What really I'm asking you is, are all 25-year-old tumors tested?
no.
Okay. So tell us how it is.
So currently, let's talk about endometrial, because for ovarian cancer, unless someone has a very strong history that suggests a Lynch syndrome meets criteria, the tumor will not get tested. For endometrial cancer, internationally, there is a real push to do universal testing of the tumor to see if these genes are functioning. So if they're functioning, they'll make proteins, protein products that we can basically test, and it's visible on the tumor when we look under the microscope, or it's absent, we can have a mutation. So right now we do it based on history. So someone has to meet criteria. But in the near future, probably with through CCO, who Dr. Russ Bocher is our governing kind of these guidelines for Ontario, that women under 70, it will be recommended, and it'll be a hospital by hospital basis likely. So once someone has a tumor that doesn't produce this protein, then they can be tested or go for genetic counseling, and then counsel about possibly genetic testing.
Yes.
Hi, I have a question directed to Dr. Wright, and I'm not sure if you're familiar with a recent study that came from Australia on increased risk for breast cancer. And so I'm just wondering, with regards to screening what the recommendations would be for breast MRI or increased risk.
So, yeah, I did not talk about breast cancer residual syndrome, but it has been